Welcome back. Doctor's Hospital provides care that is world-class and Olympic level. As the only provider with multiple specialty trained sports therapists at their division clinic. Joining me now to tell us about this is Dr. Kent Bazard, neuromusculoskeletal medicine, sports medicine. Good morning, Dr. Bazard. You had me there for a second.
Good morning. Thank you for having me.
Yes, welcome to Bahamas at Sunrise.
Yes,
So
you.
tell
It's a
us,
pleasure to be here.
what is sports medicine?
So, sports medicine is a relatively young arm of medicine.
Okay.
It's probably officially about 30 years old. Pretty young, younger than me. And so it came about initially as a result of needing a physician that can specialize in the non-surgical care of orthopedic conditions. And it kind of blossomed from taking just care of orthopedic conditions and athletes to also working alongside the family medicine physician and working alongside some of the like endocrinologists and rheumatologists to manage their patients, again, from a medical point of view, with their illnesses like hypertension and diabetes, rheumatoid arthritis. And also a physician that was specially trained and knowledgeable about the aspects that these patients and also the athletes need to know about, like their nutrition, their diet, their activity level, and their performance levels. Because often the athlete or the physician who were managing these athletes had no knowledge really about how they're trained and how these athletes are assessed. So you treat a patient, but treating the average person with a knee injury is slightly different from treating an athlete with a knee injury. So, and it's even more different treating an obese patient with a knee injury. So there's more things to consider. So sports medicine came about from that need.
Wow. Talk about the process of evaluating and diagnosing specifically a sports injury.
Well, there are different aspects. So one of the first things is we're deeply trained in biomechanics. Biomechanics, I like to call it the physics of the body. And I love physics. I say it everywhere I go. And so by understanding how the body moves and how that relates to the way forces are communicated throughout the body, you evaluate the mechanism of injury. So we tend to have a deeper understanding of the mechanism of injury. Once you understand the mechanism, you can get a better assessment of what exactly is injured and therefore what needs to be fixed. And you can it also helps you to come up with a plan also to fix the problem itself. So first of all, we want to assess the mechanism of injury. We want to determine what exactly was injured. We assess that by doing different tests like range of motion testing and different clinical tests to determine or confirm or rule out what it is that it is injured and what needs to be worked on. And a big part of that is really assessing the entire patient, assessing their nutrition status, because that's part of the recovery, that's part of their rehab, assessing their mental status. A lot of times we give these patients work, we only spend a short time with our patients. Even the therapists only spend a short time with the patient. The patient has to do a lot of work at home. And I always try to emphasize to them that most of their recovery is going to be done by them at home.
Yeah.
So you have to assess their mental status as well. So it's a pretty involved process, that first initial assessment of the patient.
What are some common misconceptions that come with, saying that you practice sports medicine?
Well, sports medicine is such a broad area, and the truth is, everybody from the massage therapist to the clinical physician, clinical sports medicine physician practices sports medicine or comes under sports medicine. But all of our jobs are different.
Yeah.
Training is different, and but we work together as a team, and we all come under the branch of sports medicine. So where I may be clinical sports medicine, the massage therapist, or you have what they call a sports masseuse or a sports massage therapist, who works with athletes and specifically works with alleviating their pain and helping them with range of motion. They also come under the umbrella of sports medicine. So it's a common misconception that one, we're all the same. And there are many aspects and there are many arms of sports medicine and professionals with different jobs and different training.
How has technology, I want to say, advanced and also changed the face of sports medicine in recent years?
Oh, well, we can start with telemedicine. Well, telemedicine is not as new as it was, but it's still fairly new. Being able to communicate with, and I would like to include, electronic communication in that as well. So it's not just video calling per se, but I communicate with a lot of my clients through whatever tracking app we may be using to track their progress. So a lot of that allows for us to have an ongoing communication with our patients. If you remember when you were much younger, you saw your doctor once a year, you never saw them again, never heard from them again. Where my athletes see or hear from me fairly often. So that's one thing, the communication. On the horizon right now is AI, and AI is scary and exciting at the same time. So, but the good thing with AI, it can kind of predict what type of performance metrics we would expect if we were to implement a certain type of treatment or training to this patient once we have their biometric assessment. And that's another technological advance. The biometric assessment has kind of progressed from me having to touch this and feel that and move this and listen to that to now telling the athlete, okay, just stand up in front of this camera, press a button,
Wow.
and I can see what you can do and what you can't do. So that's a big jump. It means that we can kind of offer pretty accurate care from a far distance. It also means that we can predict and plan how this person will do if we implement a certain program. So it's good that you don't have to kind of guess that or use previous data that worked with other people, what we call research or what we call the literature, and we can actually see, okay, for this athlete, if we do this plan and we run that through AI, most likely this is the response we will get. So that's some pretty exciting stuff.
And question, in terms of if you have an athlete who's training, working out, do they contact you before they have an injury rather, or is that something that pretty much sports medicine is treating symptoms? Well,
sports medicine is always there and should be always there. Now that's a more administrative thing in many instances because it's not, the availability is not always there. But now that we have more sports physicians that are being trained, now as a parent, you can have your child engaging with their sports medicine physician early on in their season or in their off season, and as this even if you're working along with a pediatrician, as your physician is tracking your athlete, now we have data, we have information, we know last year they had this injury, it's improved, and so we will implement this year to make sure that we prevent this injury. So you're always there even before the injury occurs. And I try to be as accessible as possible to my parents, to my athletes, and all my patients.
Speaking of accessibility, how can folks get into contact with you?
Oh, well, I operate presently out of the Empire Fitness Center in Seagate Plaza. The number there is 364-2001. And when Doctor's Hospital opens its sports medicine program, when we launch it, I'm going to be pretty much everywhere you can see Doctor's Hospital, hopefully, and easy to contact from once we establish our main office for the sports medicine home base, which most likely will be at the Cable Beach office, but I can't speak to that right now.
All right.
But right now, Empire Fitness Center, Seagate Plaza.
Exciting things to come. I'm sure athletes all over the Bahamas are breathing a sigh of relief that they're going to get the help and the guidance that they need.
We're here to support.
All right. Well, thank you so much for joining us this morning.
Thank you.
And thank you for watching Bahamas at Sunrise. We'll be right back.